Hello everyone. It's been a while since I've recorded, but since I last recorded, we've had a major change. Our office moved, so these are the new digs. Still trying to figure out how this works with recording. So if there are any issues with these first couple of recordings, be sure to let me know in the comments so that I can address them and hopefully create good recordings for you guys in the future as I have in the past. So the purpose of this recording is to talk to you guys about childhood exanthems. Childhood exanthems literally just mean rashes that we expect to see in small children. Kids are always getting sick with one thing or another, but there are a couple rashes that most kids at some point will experience. Now, some of these we now have vaccines for, some we don't. But literally, these just mean you could kind of cross out the word exanthems and say rashes, because these tend to be infections that lead to rashes, and actually all of them are actually viral infections. The classical childhood exanthems have actually changed over the years with the creation of new vaccines, but we're going to talk about kind of the ones that we expected, okay? All right, so here is kind of your classical list of childhood exanthems and a quick overview of the various types. So the first is one I think most people who were a child in the pre-varicella vaccine era remember: chickenpox. I had chickenpox when I was about 4 or 5 years old, and I still remember it pretty clearly, which kind of gives you an idea of how significant an illness it can be. It's not so much that children get very ill with it, because most children do not get very ill with it, but it is very uncomfortable. You wind up getting this rash that pops up in crops everywhere. It begins with kind of a 1 to 3 day non-specific viral prodrome, fever, respiratory symptoms, etc. You get this very pruritic, very itchy rash, which can scar and cause all sorts of other mild cosmetic issues. This is actually the one that when I was a kid, parents would kind of try to plot once chickenpox was in a classroom when their child would get it. So this is the one that in the 80s anyway led to pox parties, because the other ones that we would have historically had pox parties for, like measles or smallpox, there are thankfully vaccines for. And now there's a vaccine for this one too. But when I was a kid, my cousin caught it, and my mom promptly brought my sister and I over for a play date so that we could get chickenpox. Thanks, Mom. Anyway, the next one that people routinely think about is roseola. Roseola, there is no vaccine for currently. Roseola, I'm going to have a separate video on. This one is a fairly non-specific, non-threatening kind of infection. It's a human herpes virus. I have human herpes virus 6 listed here, but human herpes virus 7 can also cause roseola. Really, this one begins with actually high fever and respiratory symptoms. And when I say high, I mean pretty high. I mean, you can see little babies with fevers of 103 to 104, really, really high fevers. And that's why it's sometimes associated with febrile seizures. Kids younger than 5 tend to get this one. My own son decided to get this one when he was about 18 months old, and we were on an airplane on our way to New York. And I had no clue what he had. I was terrified, because the rash doesn't happen until after the fever. So about 2 days into his fever, the rash bloomed across his chest, and I went, oh, thank goodness, it's just roseola, because roseola will go away and everything will be fine. Measles, I've talked about in a different video. This one does have a vaccine. In fact, it's got a vaccine that you can have with rubella and with chickenpox. So the measles vaccine is the MMR and now MMRV vaccine, which stands for measles, mumps, rubella, and varicella. This one, like I said, there's several other videos on this. I have one, Sketchy has one, which is pretty good. You have a non-pruritic rash, which starts on the face. Remember, you've got the 3 C's: conjunctivitis, coryza, and then you get the Koplik spots in the mouth, 1 to 2 days before the rash. Sorry, cough, conjunctivitis, and coryza. You can also sometimes see secondary bacterial infection with measles. The other thing that I've talked to you guys about is encephalitis and then subacute sclerosing panencephalitis, which I talked to you about in your neurology block. And so there is a separate SSPE video if you're finding yourself having trouble remembering that condition right now. The fourth childhood exanthem is rubella, which is caused by ruby virus, which we actually discussed pretty recently. There's a separate video on this one. This one, ruby virus, measles, and roseola, the rashes are so similar. They all have this kind of pinkish, non-pruritic, well, ruby is actually pruritic, but pinkish kind of lacy rash that forms. Rubella also, you get this non-specific prodrome. Remember, the main key with rubella is actually how devastating it is to the fetus. So if a pregnant woman contracts rubella during her first 4 months of pregnancy, it's very serious for the fetus. The last one is one that we haven't talked about yet. That's fifth disease. Fifth disease is sometimes known as hand slap or slap cheek syndrome. It's called fifth disease because it was classically the fifth childhood exanthem. So it has a lot of different names to it, but the most common thought of is slap cheek syndrome because literally the rash looks like somebody slapped these poor kids across their cheeks. It's usually not pruritic. Once again, you get a flu-like illness which happens for a couple days prior to the rash. The thing that can be very serious is if the patient is pregnant, it can lead to fetal loss. And then also, if you have patients who normally have low red blood cells or low platelets, this can actually be a really severe illness. So particularly patients with sickle cell need to worry about parvovirus because that can actually lead to aplastic crisis in these patients. So those are the 5 classical childhood exanthems. Like I said, some of these have actually been changed out for other things at this point. For example, one of the enteroviruses that we talked about previously, which is Coxsackie virus, which causes hand, foot, mouth. That is now kind of a more common childhood exanthem, but only because many of these already have vaccines for them, so they are much more preventable than they were. That said, as vaccines are, not always received the way they should be at this point, we do sometimes see some of these guys pop up. So it's a good idea to be aware of them, how they work, and what the symptoms are behind them.